pandemic, the governor has resumed delivering the updates by phone today. Let's listen in live.
0. I would now like to hand the conference over to your speaker today, Mr. Teddy Tishon. Thank you. Please go ahead, sir.
Good afternoon, and thanks for joining today. You will hear briefly from Governor Tim Walz, Minnesota Department of Health Commissioner Jan Malcolm, State Emergency Management Director Joe Kelly, the Minnesota Department of Employment and Economic Development Commissioner Steve Grove, and we would just remind you that we ask reporters to please limit yourself to one question each with a single on-topic follow-up. And with that, I will hand it over to Governor Tim Walz.
Thank you, Teddy. Good afternoon, everyone, and good afternoon, Minnesota. I'm sorry to say we're starting this out. We had 11 COVID-19 related deaths yesterday, and it brings our total to 50 fatalities. Unfortunately, that's the trajectory that things tend to go on. Again, with the announcement of our stay-at-home executive order extending till May 4th, the purpose of that is to ensure that everyone gets the hospital room they need, gets the fighting chance to make sure that they come through this. So, again, I wanted to stress my thanks to Minnesotans for understanding. Nothing more than any of us would want to do is to get back to normal as soon as possible, but we can't let wishful thinking drive us. We need to be driven by the developments around COVID-19, the things that we're doing that work. We need to be nimble enough to pivot and change when we can, and we need to continue those very basic social distancing, washing the hands, staying obviously away from large gatherings. And I say so knowing that that this is a very important week for billions around the world. The holidays that are usually times of last evening, I know there was a lot of seders done by video conferencing and Zoom, and certainly understand the pain that that's bringing, and around the economy. We understand very clearly. I know you're going to hear from Commissioner Grove a little bit on this, but after we finished yesterday's announcements, I received calls from and texts from employers who had already been contacted by the commissioner and others, starting to figure out what do these protocols look like. So I want to thank you for that. We also noted today that the Department of Revenue under Commissioner Bowerly announced that we are extending the grace period on sales and use tax for those businesses, restaurants, bars, places of amusement. We had already pushed those off. They were coming due on 20 April. They will be pushed off till 20 May. And again, the commissioner will spend some time talking about what we're doing with businesses. We're watching very carefully what's happening in the United States Senate around potential for additional help to businesses and state and local governments. Two other executive orders yesterday, and I think it just bears highlighting a little bit of all of the things that are happening here and all the people who are involved with this. The first one may seem, and again, it's one of those things that maybe people don't spend a lot of time thinking about, but certainly when you need it, it needs to be done. Our septic tank, we issued an executive order for the trucks to make sure that they're get out there to do the pumping services to keep things working the way they're supposed to. So it may not be glamorous, but it is absolutely necessary, and a thank you to the folks who are making sure that everything continues to function as it should. And the second one was authorizing the Commissioner of Health to suspend certain requirements that fall under their regulatory authority. Basically what that did was allow for bed moratoriums to making sure we're upping the right numbers for our surge capacity and those freestanding alternate care sites. So that allowed them to make some of these changes as they're working around the clock to make sense. I also spent the morning on different numbers of calls. I spoke pretty extensively to a lot of our tribal leaders and the things that they're doing. They're very dependent on the federal government's responsibilities, treaty responsibilities, but I'm proud to hear them say that they're hearing amongst their counterparts across the nation that Minnesota's state and local governments are stepping up more than almost any place else. So I want to say thank you for that, for showing that true one Minnesota spirit with our 11 sovereign nations. Spoke with the rural electric cooperatives again, noting that many of them have and are making sure that power stays on during this time. Their folks are out there. They're preparing for potential spring tornadoes and rough weather. We got snow coming in today, and they're re-stressing how they're taking care of their members, but that it's hard on them too. So I've spent time there. And then the last group I spoke to some of our folks in transportation, freight train operators and our transit operators. And I just want to give a big thank you to all of them. I spoke extensively with some folks down in Rochester about what it means to be moving patients. They just asked for everyone's cooperation and patience, asked, to make sure we're boarding by those back doors that have now been implemented. Try to wear the face masks as CDC and our own health department are asking people to do when they're outside and in those situations, and to ride transit when you need to. I know most people are doing that in social distancing, but they stressed it. And brings me to just a final point before I turn it over to Commissioner Malcolm to give some more details on what's happening. MnDOT, our Department of Transportation, is participating in the global Light It Blue campaign. Tonight, the Interstate 35W bridge will be lit up blue in honor of healthcare workers and all of their essential workers. Other landmark buildings, both in Minneapolis, across this country, and across the world, really is an opportunity to show that we're in it together. So there's a whole lot of heroes. It's hard to list them all. Tonight will be a moment that will light up the world a little bit to say thank you that's happening, and that's how we're going to get through this again, Minnesota. As I said yesterday, if we hold together here, if we do this and continue the social distancing, if we let our best and brightest minds get us the testing and get us the therapeutics and eventually get us the vaccine, we'll get this thing done. And with that, I'd like to turn it over to Commissioner Malcolm from the Minnesota Department of Health.
Thank you, Governor. Good afternoon. I will just share briefly with you some of the statistical highlights. The global total as of this morning was very near 1.5 million cases and very near 90,000 deaths around the world. In the United States, we are now over 432,000 confirmed cases, over 150,000 in the state of New York, just under 82,000 in the New York City alone. The United States is reporting just under 15,000 deaths, just under 4,600 in New York City alone. In Minnesota, we now have a total of 1,242 laboratory confirmed cases in the state. That's up 88 from yesterday's total. And as I mentioned yesterday, one of the statistics we're keeping an eye on is the so-called case doubling rate, how many days it takes to double the rate of growth, and that has remained stable at about 8 days for the last several days that we see a doubling of cases in Minnesota. That's just a kind of an important sub-indicator that we're watching closely to keep an eye on the rate of growth. And as the governor mentioned, sadly, we had our largest number of deaths related to COVID-19 yesterday, 11 more deaths for a new total of 50 collectively in the state. There were 3 people in their 70s, 4 in their 80s, and 4 in their 90s. So the age distribution of the deaths continues to skew toward the elderly as we have expected. As of today, there are 145 patients currently in the hospital. That is an increase of 10 yesterday. There are 11 more patients added to medical surgical beds and 1 fewer actually in intensive care. So of that 145 total today, 63 of those are in intensive care. I'd like to spend a minute talking about the importance of getting the statistics right when it comes to counting deaths related to COVID-19. And there's been some, I think, confusion about this and some misinformation about this circulating in social media that I just wanted to address head on today. Last week, on April 2nd, the CDC's National Vital Statistics System published specific guidance on how to report the cause of death on death certificates for cases involving COVID-19. There can be a lot of variation in how cause of death information is recorded, and it's really important that there's as much consistency as we can get on this, because that accuracy helps us to have a better understanding of the real prevalence of this disease, especially at a time when the testing process is still more limited than we would like. As we've talked over and over again, we know that test-confirmed cases are the tip of the iceberg. The latest CDC guidance was a follow-up to earlier similar guidance from CDC that was trying to help standardize the early reporting. Without this standardization, it's likely that the same kind of variation we've seen for years in cause of death statements could lead to some real confusion and records problems when we later go back to try to determine how many people actually died from COVID-19. So there was a reason why CDC wanted to be quite specific about the guidance related to COVID-19. Following that federal guidance, our Health Department Office of Vital Records has been working to ensure that deaths will be counted as confirmed COVID-19 deaths only when the information that a medical certifier provides in a written cause of death statement explicitly mentions COVID-19, not counting other variations like corona infection due to pandemic or non-standard abbreviations like COV. And so who is a medical certifier? That is physicians, advanced practice registered nurses, and physician assistants. So the standard information that is reported then into our Vital Records Office is then sent to the CDC and coded into the global system of standardized records known as ICD-10 coding. There are death records that list the immediate cause of death as COVID-19 because it was confirmed through laboratory testing. When deaths are registered as suspected or probable COVID-19, we don't just leave it at that. The MDH Office of Vital Records staff follows up on these death records. Staff contacts the medical certifiers to ask them if testing came back to confirm COVID-19. When it has, the medical certifier updates the cause of death statement that they previously registered or provided. There might be records that stay as suspected or probable if the cause of death statement was written but testing was never ordered or the record doesn't get updated by the healthcare provider. These will be coded with ICD-10 codes that are related to but different from the confirmed COVID-19 deaths and will not be counted as COVID-19. This allows us to have better clarity on the confirmed number of COVID-19 deaths versus deaths that may be but that are remaining in less certain status. It's important to know that all of these processes are similar to those that have been used in other disaster responses over the years, including hurricanes and other outbreaks. Certainly it's the case that there were deaths that happened before testing was available, in which patients died of a cause that had symptoms similar to COVID-19, but an infection was never confirmed, and the person who died may already be buried or cremated, and no further testing is possible. A key point to emphasize here is that the only people who can retroactively change the cause of death statement on filed death records are the medical certifier, the physician, the advanced practice registered nurse, or the physician's assistant who certified the death record, or the medical examiner and coroner who has jurisdiction over the death. MDH Office of Vital Records staff facilitate the correction process, but we do not make changes without that documentation and involvement of the medical certifier. Correcting a record to ensure accuracy is important to us, and it's important for public health and for families, and so that's why we're doing the extra investigations to try to correct the records where that is possible to do. There's absolutely no policy or political motivation to increase the number of deaths that are reported. So we just ask people to try to help us clear up this confusion around the guidance and why it is that we are looking to assure that these death totals are as accurate as they can be. And with that, I will turn it over to Director Kelly.
Thank you, Commissioner, and good afternoon, everyone. Making good use of the extra time we've been given to get ready. Late yesterday, we sent another request to FEMA. I asked them to approve what's known as non-congregate sheltering for this incident. And I know that's kind of a mouthful, but it simply means that we would like to be eligible to get reimbursed for providing people affected by COVID-19 a separate place to live while they go through quarantine or isolation in order to reduce community spread of the virus. In a typical natural disaster, we put together congregate shelters, and to congregate means to collect in a group. And to illustrate what that means for sheltering, let's say the river comes up and we have to evacuate part of town. We set up cots on the high school gym floor, bring in food, water, diapers, and other supplies. People go to the shelter and live in a group setting until the danger passes and they can go home. That type of sheltering is common as well as cheap and easy, and FEMA typically pays for that without pre-approval. Having people exposed to coronavirus live together or be around others who haven't been exposed is a bad idea. That just makes it easier for the virus to spread. If a congregate shelter, a group shelter, is a bad idea, we need to provide non-congregate housing, and we're asking FEMA to commit to pay those costs. So remember, when someone tests positive or has been exposed to COVID-19, they need to go into isolation or quarantine until there isn't a risk of affecting anyone else. The doctor tells you to go home, isolate yourself for a couple of weeks, and call the clinic if your conditions get worse. But what if that's not possible? What if the person is experiencing homelessness? They don't have a home to go to. What if the person can't return to their usual residence because of the risk of exposing other household members to the virus? Think of a couple who share a studio apartment. In these and a lot of other scenarios, we need to provide people a safe place to quarantine so we don't make the problem worse. Our plan is to put affected people up in hotel rooms, dorm rooms, or the like, and provide the support they'll need to complete their isolation period if they can't do it at home. Instead of creating a complicated shelter system, we just want to use the space that's already available, compensate the owner, and get reimbursed by FEMA for the cost. And we think this simple approach will help Minnesota get through this thing by taking care of people and not adding to the risk of community spread. We'll keep you posted when we hear back from FEMA on our request. Thank you, and I'll turn things over to Commissioner Grove. Commissioner.
Thank you, Director Kelly. Good afternoon, everyone. As the Governor said a moment ago, we are beginning to plan for what protocols might allow us to get some of the 18% of the non-critical workforce in Minnesota that's currently not working back into the labor market. We're working with our colleagues at the Health Department and Labor and Industry on what that could look like, what kind of social distancing could we do to get there while making sure that we don't lose any ground on the amazing progress people of Minnesota have given us on fighting the virus by staying at home and social distancing. So we're talking to lots of business leaders, labor leaders on this topic, and just getting some great advice and innovative ideas, and we'll continue to do that in the coming days. As I said yesterday, we were the first state in the country to authorize the additional $600 top-off payments from the CARES Act that the federal government approved. We have now cleared more than 236,000 applications that were eligible for those benefits, totaling $141 million, and we're clearing more by the minute. So we'll continue to do that to give Minnesotans the money that they deserve from that federal CARES Act. We saw yesterday 18,762 new unemployment insurance applications. That's down compared to last week at this time when we had 24,504. So again, each day we've seen kind of a decline in the number coming in. Still high numbers, but since last Friday, every day has been a week-over-week decline from the past week. And again, we believe this is just because the governor moved very quickly right away to open up those benefits to people affected by COVID-19. So they got kind of a jump start on this, which was, I think, really useful for Minnesotans and for our team to begin to make progress on these important levers to provide for economic security. We encourage people to continue to use UIMN.org. Our call lines are open. The wait times are getting better. We're averaging about an hour. We want to encourage folks to call in the morning. That's just a better time to call. The lines are a little lighter then. And just to try to be patient when you're on hold. If you hang up and start over, of course, you're kind of back to the end of the line. So this is a difficult time, and we know sometimes talking to a person makes a difference. So call in if you'd like. But again, UIMN.org is the best place to get answers and apply directly to our system. Wanted to give a little bit of a deeper dive in unemployment insurance applications. We are at a total now since March 16th of 385,318 new unemployment insurance applications. You saw the federal numbers out today, over 16 million nationally. So this is happening in every state, of course. The top occupational groups that we have seen thus far are as follows. Food preparation and serving at 74,574. Sales and service at 38,799. Healthcare, including practitioners and support, at 36,668. office administrative support at 28,785, and production at 20,491. So, as you can see in those occupations, particularly food prep and healthcare practitioners and support staff, match up a lot with positions that are also hiring in other vectors. And we'll get to that next. I want to just highlight that, of course, there are firms that are hiring. The National Labor Exchange, which is how we measure employment here, 4,815 new job postings. That's just a sampling of all the postings in the state, but it gives us kind of a good look into who is hiring right now. And it's up 3% from last week. And the top 10 occupations being hired are home health aides, personal care aides, security guards, social and human service assistants, combined food prep and serving workers, registered nurses, customer service representatives, first-line supervisors of food prep, first-line supervisors of office and administrative support, software developers, nursing assistants, and computer system analysts. So there is a lot of hiring happening as well. We encourage everyone in the state to go to careerforcemn.org and find job opportunities there. We are highlighting all of the growing job opportunities in skilled and demand jobs that are in critical sectors. Of course, our Career Force Center is operating primarily by phone and online. There's just a lot of virtual resources there to take advantage of: online workshops, virtual career fairs, etc. So take a look at careerforcemn.org and you'll find out more. We're going to continue to ramp up and help those critical sectors get the workers they need at this really critical time. Lastly, we continue to see businesses do amazing things. We have a Dyna-based hockey jersey factory called Gemini Athletic Wear that is selling hospital-grade face masks with CDC-specified fabric. They've cut 15,000 masks with their production lines and have suddenly become a major supplier to the CDI Vascular Care LifeSparks Nurses Group with 2,000 masks going out to them and many others. So, great Minnesota story of a hockey jersey company turning into a face mask company at a time when the state needs them most. So we're grateful for companies like Gemini Athletic Wear and others that are retooling their work to help our state get through this time. With that, I'll turn it back to the governor.
Well, thank you, commissioners, and again, thank you to everyone on the media for your flexibility yesterday as we kind of did a pool process. I'm really grateful for that, and now I'd like to open it up for questions to everybody.
Operator, we're ready for questions.
We've been listening to Governor Walz's daily update on COVID-19. We heard from him that the 35W bridge will be lit blue tonight to thank healthcare workers, along with other landmarks across the country who are also doing that. We also heard from Commissioner Jan Malcolm that Minnesota's rate of COVID cases doubling remains at 8 days. That's an important indicator that health officials are tracking to see if the stay-at-home order is working and how much the virus is spreading in Minnesota. We also heard from Commissioner Steve Grove that new unemployment applications are on a decline right now and that hiring in Minnesota is also up 3%. He recommends if you are applying for unemployment and you want to get a hold of someone, the best thing to do is call in the morning and expect to wait about an hour. We also expect to hear from Wisconsin Governor Tony Evers tomorrow afternoon at 1:30, and we will carry his address live. Of course, you can always check the WDIO website and mobile app for the latest, and we'll be back for WDIO News at 5.
This has been a WDIO News special report.